For most of human history, death was not measured. It was recorded vaguely, inconsistently, or not at all. Different cities used different words. Different governments used different categories. The same illness could be counted 10 different ways, or ignored entirely. People died from fever, from weakness, from unknown causes, sometimes from God's will. There was no global standard, and without a standard, there was no reliable history of disease. As cities grew during the Industrial Age, this problem became impossible to ignore. Urban populations exploded. Factories concentrated workers into crowded housing. Diseases spread faster than governments could respond. Officials needed answers, not theories. They needed to know what people were actually dying from, how often, where, and why. Without that information, governments could not plan. They could not control outbreaks. They could not justify policy, so they began to classify death. Early disease classification systems were not designed to cure illness. They were designed to count it. If something could be counted, it could be managed. If it could not be counted, it remained invisible. By the early 20th century, classification systems existed across Europe and North America. But each country classified disease differently. Global comparison was impossible. History, as data, was fragmented. That changed after World War II. Disease no longer respected borders. The World Health Organization took responsibility for the international classification of diseases. From that moment, disease classification became global infrastructure. As medicine advanced, so did the system. Chronic illness replaced sudden death. Mental health became visible. Injury and long-term conditions mattered. The system expanded to reflect modern life. ICD-10 marked a turning point. It did not just record death. It recorded life lived with disease. And with that expansion came power. If a condition has a code, it can be tracked. If it can be tracked, it can be studied. If it can be studied, it can influence policy. If it has no code, it disappears from history. ICD-10 is not dramatic. There are no battles, no speeches, but it is one of the most powerful historical systems ever created. Because history is not only written by victors, it is written by what can be counted.